Well, tonight we continue to follow the latest developments in the Ebola crisis. Nurses around the country are saying they're not ready if Ebola shows up in their hospital. This concern comes after the Dallas nurse caught the deadly virus. Tonight, she has been identified as 26-year-old Nina Pham. This is the first transmission of the virus in the United States, and it's bringing healthcare protocol into question. MU Health says its nurses have been trained and are ready if Ebola makes its way to mid-Missouri. ABC 17's Dan Messinio talked to MU Health administrators today. And Dan, MU Health says their nurses know the red flags if a patient comes in with Ebola.
Danielle, MU Health administrators say, as with most infectious diseases, its nurses are trained in the treatment protocol for Ebola. But many nurses around the country say they are not. Nurses at MU Health and around the country will be the first ones to see an Ebola patient if and when one walks through the doors of a hospital. But the majority of nurses around the country say they're not ready and they want more training.
Ebola is in a different league, and you can't have one tiny lapse in precautions in your personal protective equipment, even when you take them off. And it becomes almost like Houdini to get out of all of those things and not have one lapse in all of that.
The importance of training and strict protocol became dangerously clear after a Dallas nurse treating the deadly disease contracted it from the first known U.S. Ebola patient. MU Health administrators say they discuss Ebola on an almost daily basis, and its nurses are prepared and trained on how to treat patients with the deadly disease.
They get routine annual training on how to take your equipment on, how to take it off, which situations do you wear what. You know, sometimes only gloves and gown are necessary. Sometimes you need a negative pressure room, et cetera, et cetera. And that is ongoing at all times.
A recent National Nurses United survey shows an apparent lack of communication on Ebola in U.S. hospitals. It found that 80% of nurses say their hospital hadn't talked to them at all about Ebola treatment policy.
We're going to have to get trained in that and practice it and be ready, so that we assure that our nurses everywhere are protected and have the skills to use the personal protective equipment. And that's a challenge facing us right now.
MU Health administrators tell me one of the red flags their nurses look for is travel history. They said if patients come in with flu-like symptoms who have recently traveled to certain parts of Africa, then that would be a major cause for concern. Reporting live at MU Health in Columbia, Dan Messinio, ABC 17 News.
Thanks, Dan. Health officials say unlike the common cold or flu, Ebola can only be spread by coming into contact with a sick person's bodily fluids. This is why nurses and other healthcare providers are at a greater risk of getting that disease.